All right, so part 3 of this. Now we're getting down to business. We're going to actually go in, Dr. Rosenberg is going to go in and do the procedure so that you can see how easy it is, how painless it is. And let's talk a little bit, you and I were chatting about how this is actually covered by insurance.
Yeah, varicose veins are an insurance-covered benefit most often, especially if there's symptoms associated with the veins. Symptoms don't have to be painful veins. The symptoms commonly, actually, the veins don't always hurt, but the leg is uncomfortable, it's heavy, it's cramping, people get charley horse at night, restless legs, stinging, burning, that kind of thing. So if I ask someone, do your veins hurt, often they say, the veins don't hurt, but boy, my leg bothers me. And that's an indication the veins are causing a problem, and that becomes an insurance-covered benefit.
Gotcha.
Whereas spider veins, or little tiny blue-purple veins, those are cosmetic. We treat them often, but they're self-pay. They're not a medical issue. But varicose veins almost always are a medical issue.
And there is a difference, because we were chatting and how the spider veins, although they're unsightly, they're not very attractive, those thankfully don't become medical issues. But it's important to come get a screening because you never know what is going on in your leg until we actually do that.
No, that's right.
All right, let's go for it.
So, when we look at the leg first, we see the leg looks very nice. There are a few small varicose veins across the knee that I don't know if they can show up well on the video, but I do see a few small ones here, and then a few spider veins in the calf. And so what we'll do with the screening ultrasound is just take a picture of the veins running inside the leg. And of course, this is a painless procedure. And we'll look at the veins here. Everything gray on the screen is normal muscle and normal tissue in the leg. As we come across here, we see a large black circle. That's a vein. And anything that's black and circular like that is a vein. And that becomes a varicose vein as it gets close to the surface of the leg up here. And so what we'll do is look at the direction of blood flow by looking at the color here. And the color blue would indicate blood is going in the right direction. And red would indicate there's backflow or pooling of the blood. So blue is good, but we don't want to see all that red. So red means
this is not good for me.
Red means we have some pooling of the blood. So instead of blood going up this way, it's running back down as gravity is pushing. Pressure comes in and the veins expand like a balloon bubbling up. And when you see the veins across here, that's the source of these varicose veins. So on the screening, we would say, yes, there is evidence. There's a little bit of venous insufficiency or varicose veins, and that would merit a further, more detailed ultrasound from top to bottom, front and back, to see more anatomy, so we then know how best to address that issue. So the screening ultrasound will just look at certain points along the leg to see, is there evidence of a vein problem? And if there is, then we would suggest, well, you probably need a full workup. If everything's normal, we would say, well, not necessary. Okay? So
I'm never normal. We already know this.
So this is basically what a screening ultrasound will look at the veins inside the leg, and we would find the varicose veins up here, and then know that there is something maybe we want to address at a later date.
Okay. Well, there you have it. So you can also know too, make sure you make your appointment for a screening. It's very important. Painless, I'm fine breathing. Do you allow cocktails? I'm just kidding.
Only after work.
There you go. I'm Dina, Carole. Look for the description so you can make your appointment with Chemo 3 Records.